I'm Dr. Kim Newell Green, and I'm a pediatrician in San Francisco County. I'm also the past president of the San Francisco Marin Medical Society. Emma, would you like to introduce yourself?
Thanks, Kim. I'm Dr. Emma Steinberg. I'm a pediatrician and a chef also in San Francisco.
In the orientation to the Champion Provider Fellowship, I sat next to Dr. Emma Steinberg, and we began discussing many of our shared interests. We quickly determined that both of us were passionate about food and nutrition and had worked in these areas in our personal and professional lives.
It was really amazing to have the Champion Provider Fellowship bring Kim and me together to be able to work together on advancing food as medicine and thinking about innovative ways to fund these programs within the healthcare system.
So medically supported food and nutrition refers to a spectrum of interventions that provide nutrient-rich whole food used for the prevention, reversal, and management of certain health conditions. These include things like medically tailored meals or groceries, food prescriptions, and healthy groceries, as well as nutrition education and administrative assistance to help patients and families get access to available food supports. You know, when Emma and I met at the very beginning and I realized, gosh, we have a lot of interests in common. And I think that our work could be made better, could really be amplified by working together. That really happened, exponentially when we worked as part of this larger coalition.
I think that's one of the benefits of the Champion Provider Fellow network and system is that it really does bring people across the state together. So it breaks down those silos, it breaks down those barriers. So where there are small things happening on the ground in other places, this fellowship and the sort of network and connections that get developed through the different local departments of health really allow us to potentially amplify the work. We partnered with community-based organizations, the San Francisco Health Department, several policy and think tank organizations, as well as members from health insurers and other healthcare providers throughout the Bay Area.
What we were able to do is work with a bunch of multidisciplinary partners who really understood lots of different aspects of this problem and also who had a large network that we could reach out to. And so working with our partners, we were able to develop relationships with people who could educate us about this complex area along the way.
And I think that is one of the other really, really powerful pieces of the Champion Provider Fellowship is that larger network, so that as these different pilots are happening in different places, people can collaborate and expand the work together.
Emma and I came in with lots of areas of interest and ideas, but realized that the health department helped tell us, well, that idea has actually already been done in our county, or that one's never going to work right now because of these structural barriers. And so recognizing that all change really starts locally, we were able to they helped us navigate to find the kind of work that both matched our own skill sets and interests, but also really matched the community that we were really living in.
One of the other things we tried to do in addition to the waiver was really think about other avenues that we could garner support for these types of services. So part of our coalition was involved with local government. And so we were able to actually help craft multiple bills through the state assembly to try to garner additional funds to support medically supportive food and nutrition services and pilot these types of interventions in counties throughout California. And I know for me, I learned a ton about how these different organizations interact with each other and who helps clarify for people on the ground, or the health insurers, or the patients going into clinics, how these different policies on a high level then trickle down and actually get operationalized for patients that we serve.
We show up as experts with state level policymakers to help smooth the way for these kinds of changes at the policy, system, and environment level.
it really did help for us to have our medical background. And I was really surprised actually at how important that was, and how providing that lens and that perspective based on our training and our experience with patients on the ground really helped add quite a bit to the work that we were doing. And that perspective was really important.
Now what we're doing as a coalition is really trying to figure out, so this work is supported sort of theoretically, and now we're supporting health plans with a variety of educational resources and communication strategies to try to make sure that the kinds of interventions that are now possible actually happen in the field. So it's really, this work is a marathon, not a sprint, and we're really excited to continue to be a part of this coalition and push the work forward.